I'm going to introduce our first presenter, and that is Greg Margulies from Pacific Group Agencies. Greg, you want to bring up your video and audio? There he is. How you doing, Greg?
Good, Mark.
Okay, you are already a co-host, so what I'm going to do is give us just a brief introduction here. So Greg is with PGA, as I mentioned, and RESDC and PGA Pacific Group Agencies is RESDC's benefit plans administrator, and Greg's going to be discussing the 2022 open enrollment period, which we are right in the middle of. He will also provide information on the array of benefits exclusive to RESDC members and answer questions once again through the chat function that I collect at the end of his presentation. So without further ado, Greg, I'm going to turn it over to you. I'm going to mute.
Thank you, Mark. Okay, so many of you are probably very familiar with our organization, Pacific Group Agencies. We've handled the benefits for RESDC for, I believe, 18 years now. We handle the dental and the vision plans as well as some other plans. One of the most common questions we get, it's always the dental. What's better, the HMO or the PPO plan? And no matter how often we try to explain it, that's always, people always think one is better than the other. So I want to just give a little information on the two plans. One isn't better than the other, it's just how they work. A PPO plan gives you the freedom to go see any dentist you like. For that freedom, you're going to pay a little more out of pocket. And the insurance company is going to pay a percentage of the cost of the treatment. HMO plans, you're restricted to the network. You have to see one of those dentists. The trade-off there is that you get set copays. A dentist can't charge you $500 for an item. They have to charge you the copay that is listed in the charge schedule. So those are the main differences between the two plans. Hopefully everybody can see the screen. For this coming year, the PPO plan, which is by far our most popular plan, it's offered by Emeritus, which is one of the largest dental carriers in the United States. No major changes to the benefits that are currently in force. You get a $2,500 calendar year maximum if you see a network dentist. And this kind of confuses some people where they say, well, why is there a network? I thought I could go to any dentist I like. And the answer is you can go to any dentist. If you see a dentist that belongs to the Emeritus network, basically meaning they have contracted with Emeritus to agree how much they will charge, you will receive those discounted rates. So you could save 30 to 40% by going to see a network dentist. Many dentists don't want to join the network. Those are considered non-network dentists. And for those dentists, you would receive a $1,500 a year calendar maximum. The calendar maximum, anytime the insurance company pays out $1 on your behalf, whether it's for a cleaning, which is covered at 100% and you don't actually see it, or whether it's for a crown or an implant, they deduct that from the $2,500. The plan itself is very comprehensive, covers everything from routine cleanings, which you get 3 of per year. There's no time limit in between them, so you can have one January 1st, one January 2nd, and January 3rd if you like. Then it also covers periodontal maintenance, deep cleanings. Those are the more scrubbing of the teeth, all the way up through crowns, dentures, and implants. With this plan, it pays a percentage. So the more your dentist charges, the more out-of-pocket costs you're going to have. By far, PPO plans are the most popular. The other dental plan we offer is the zero copay plan by Cigna. And this is the plan that we get confused with the SD-Sarah plan a lot. So want to explain a little bit between the two of them. SD-Sarah has their own plan that also uses the Cigna network. Our Cigna plan, we call it the $0 copay plan. because there is no cost to you for any covered procedure. And most people don't believe it, but it's true. Whether you're getting a cleaning or a crown or a denture, there is no cost to you. It is zero. And it's become a very popular plan. The one caveat of the HMO, as I mentioned, is you do have to find a dentist that belongs to the network. The Cigna network is nationwide, so as long as you're in a big city, you should be able to find a provider that accepts it. One thing I will say about the plan is on HMO plans, dentists try to upsell a lot of times. So this is something you want to make, be aware of. So when you're allowed a porcelain crown at zero, you don't necessarily need the highest end one that's designed to last 40 years. Make sure that if you get on this plan, that you take your patient charge schedule, your list of what your copays are, even though they're all zero, take it with you. That way you can show the dental office, this is what I want. It's zero cost. One thing we do recommend about the plan is when you're looking for a dentist, you'll tend to find better service if you go for a dental office that's smaller. There's not necessarily anything wrong with the larger dental offices, but the smaller ones we find have more positive response from the members. So those are the two dental plans, how they work. All of this information is in the booklets that you should have received. If you did not receive a booklet yet from us, at the end of this health fair, Mark will be providing contact information for us. Give us a call or an email and we'll send you another copy. Other plans that we offer are the vision plans. Now we offer two different vision plans, one with and one without an exam. The most popular one is the with exam by VSP. Everybody knows VSP. It's a large company, nationwide providers. If you can see on your screen, the list of benefits. If you go see a VSP choice provider, which is their largest network, things like your exam are covered at no cost to you. Most lenses are covered at no cost to you, and you get $200 towards frames. So anything above $200, you're going to be paying. Under $200, the insurance company is going to pay at 100%. This plan also comes with a lot of add-ons that are available. Most vision plans don't. So if you're looking to get the photochromatic lenses, those are the ones where when you're inside, they're clear, but you step outside into the sunlight and it suddenly becomes like sunglasses. Add-ons like those are covered at greatly discounted rates. This plan is perfect for the person who needs a set of glasses every couple of years. Highly recommend it. It's low cost. It's one of the few insurance plans that easily pays for itself. The second vision plan we offer, it's the one that we call without an exam. And this one allows you to go to any provider you like. It pays a set dollar amount. So if you're, regardless of whether your single lens costs $100 or $20, this plan will pay out a maximum of $40. This is designed for the enrollees who have medical coverage through Kaiser or HealthNet. Both those plans offer you an examination every year. So there's no real reason to buy a plan with an examination when you're already getting one for free under your medical insurance. Again, this is a scheduled plan. Go anywhere you like. You can go to Costco, you can go to Walmart, you can go to Lens Crafters, or you can go to a boutique provider. It doesn't matter. It's going to pay out the same amount. For the last 10 years or so, we've been offering a bunch of other additional plans available to the members of RESDC at discounted rates. You can see them here. We have pet care plans. We have two of those, one that works like a PPO and an HMO. The PPO, as always, go to any provider you like. HMO, you have to see one of their vets in the network. The Legal Shield plan, It's extremely popular. It gives you access to attorneys at no cost to you. They'll do a will for you for free. If you get audited by the IRS, they're there to protect you. They will go to court if it gets that far, no cost to you. They'll review documents on your behalf, no cost. Another one of the plans is the ID Shield, becoming extremely popular right now with identity theft going on. Not only does it monitor your credit reports, they monitor a lot of sites on the internet that are selling personal information. So they will alert you to situations when something pops up. We've had issues with members where somebody was buying a bunch of TVs at a department store in Texas. It flagged it, it stopped that purchase. We've had other ones where they were trying to set up a gas account for somebody in Tennessee. Person didn't live in Tennessee. It caught that right away and stopped it. If for any reason it doesn't catch it and your identity is compromised, it will repair it at no cost to you, regardless of how much time or money it takes. They will take the lead. We have personal accident coverage, which protects you in case of a covered accident. If you're seriously injured, it also has some travel benefits. There's a lot of different travel benefits, including the most popular, which is medical evacuation. You get sick on a cruise ship and you need to be airlifted to a hospital, that can easily run $40,000 to $60,000. Medicare doesn't cover it. Medical insurance doesn't cover it. This does. Other travel coverages are with Travel Guard, so that if something pops up and your trip is canceled, say like a worldwide pandemic, and your trip, you can no longer go on the cruise and the hotel doesn't care, they're not giving you your money back, this would reimburse you. The Emergency Assistance Plan, great plan. It's an annual plan. It covers you for many things, incidentals, that the regular medical insurance and travel insurance doesn't. Say if you're driving on a trip to see your grandkids in Oregon and something happens, who's going to drive your car back? This company will. Who's going to provide a nurse for you on a plane trip back if that's what's required by the doctor? This one will. Great company. Other plans, we have life insurance. You do have to be under age 76 to get it, and ideally healthy. It's term life, pretty well explained in the booklet. And here's the last benefit, is the one that is sometimes confusing to people. Amplifon Hearing. It's a free benefit, no cost to you. It's a hearing aid discount plan. You call this company up and they will match you with a provider in your area. You'll save up to 40% off of hearing aids, and they'll throw in a lot of extra benefits. And those benefits change over time. Sometimes it's free batteries for life. Sometimes it's annual checkups for hearing at no cost. It just really depends. Sometimes they'll do financing at no cost to you. So you want to call those people up if you need a hearing aid. During the open enrollment time, which we've listed in our booklet as ending on November 12th, that is the hard deadline for the dental and the vision plans. So if you're looking at one of those, you have to get us the paperwork as soon as possible. The other plans, the pet care, the legal, travel, all of those, they can be done at any time during the calendar year. So we do recommend you do them now, just so you don't forget about them and say, I wish I had purchased that when I had the chance. But you can do those at any time during the year. So Mark, that basically sums up the benefits we offer to RESDC, excuse me.
You work with a lot of codes and decks, and
we work with 20 plus different counties.
You work with 20 different counties, so not a problem.
Similar acronyms.
Yeah, this will prep you for that next presentation.
Yeah, tomorrow.
Thank you very much, Greg. If you wouldn't mind stopping your share.
Absolutely.
And I'm going to just bring up a screen real quick. Let me just make sure I can find it. So as Greg mentioned, you can see at the top Pacific Group Agency's information, contact information, their website you see there. I'll leave it up for while we're going through the questions. You're also going to see SD Sarah's and My Senior Health Plan, so I'll bring this back up. once they've completed their presentations. Let somebody else in here. And then the phone number, 800-511-9065. I think that goes to your home too, right, Greg? 24 hours?
24/7, call me, I'll answer. And I'll call you back at 3 in the morning.
All right, so we have a couple questions. First question is, regarding the Cigna plan, can you further describe what is a covered procedure?
The plan has approximately 380 procedures that it covers. So a covered procedure is anything that the insurance company will cover for you. That includes cleanings, x-rays, crowns, dentures, things like that. So each one of those procedures has its own dental code. And there are 380 different procedures that are covered under this plan. You're not going to find a procedure that's, not covered in this plan generally. It's a very comprehensive plan. So it's going to take care of you from just the people who have great teeth and only get a cleaning done, once or twice a year, all the way up through those people who need 6 crowns. It's going to be covered.
Okay. Next question, and a little editorial here, which I think you'll appreciate. I have your terrific PPO plan. Dentist wants to replace 2 missing teeth next to each other with implants. What's the least expensive option? I'm not sure if that would be something that you'd want them to call you about, or if you can explain here today.
Right. If the teeth were extracted while under the insurance, then it will be covered by the insurance. The least expensive option is probably going to be a bridge. You can get implants in those 2 teeth. They are fairly expensive. And quite honestly, you'll probably want to spread those out over 2 years just because they're so expensive that they will take up a significant portion, if not all of your calendar year maximum. If the teeth were extracted before the insurance became into effect, it's not covered. It's the same as getting into a car accident and buying car insurance after the fact. They're not going to pay to fix your car. This insurance company is not going to pay to replace teeth that were already missing.
Okay. The next question, the last question for you, Greg, is my COBRA is due to end August 2022. How do I enroll mid-year in the dental and vision?
You have 60 days from a qualifying event. So qualifying event would be your retirement and losing your benefits or your COBRA ending. Just contact us, and you have, when I say 60 days, so if I believe you said August 22nd, so you're
August 2022. August 2022.
Okay. So the last day of the month in which you retire, that's when your dental ends. You have basically 2 months after that to get us your paperwork to sign up for the dental. Just give us a call and we'll send you out the paperwork mid-year. Not a problem.
Thank you. Once again, 800-511-9065 will get you connected to Pacific Group agencies. Greg, we really want to thank you so much for your time today and your great presentation. And I know this is a very busy time for you guys over there during open enrollment, but we appreciate all your support.
Thank you. And I'd just like to say to the members that if you do call us, we're incredibly busy right now. So if we don't answer the phone, please leave a message. We will call you back. We're getting back to the calls within 24 hours, but we are swamped right now. And every time after one of these meetings, the calls spike up. So just please leave a message and we will get back to you.
Great. Thanks again, Greg, and you can get back to work now.
Sounds good. Thank you, Mark.
Great. You're welcome. Okay, I'm going to ask our friends at SD I'll ask Mary Ball. I know she's here. I sent her a chat. Mary, you want to bring your camera up and your audio? Hello.
Good morning, Mark.
It's great to see you.
Good to see you. And
Yeah,
thanks for including us
yeah,
today.
absolutely. We really appreciate your support, and we certainly look forward to your presentation. It's awesome because you hadn't even started yet, and we already had a question for you. That's like amazing. So we will get to that and any other questions at the end of your presentation. So I see your screen is up. I'm going to I just want to say just a few words, and that is Mary Ball is the Chief Operations Officer for SD Sarah, and she's going to be highlighting the 2022 SD Sarah sponsored medical and dental plans that are available during SD Sarah's open enrollment period beginning this Monday, November 19th through November 1st through November 19th. And I'm going to now get rid of myself, Mary, and turn it over to you.
Well, thank you, Mark, and thank you for everyone who is participating today. RESDC is such a great partner with SD Sarah, and we always enjoy these opportunities where we can work together. Today, I want to tell you a little bit about the medical and dental plans that are sponsored by SD Sarah. And as Mark mentioned, we've got open enrollment from November 1st to November 19th. And all of the information surrounding open enrollment is on our website. So I think we'll talk a little bit more about that later. And so it is very important that starting on Monday, if you are currently enrolled in an SD Sarah plan, or that's something you're interested in doing, that you get all the information and make sure that it's completed by November 19th. Who can enroll in an SD Sarah sponsored plan? Of course, retired members, surviving spouses and partners, and then eligible dependents. And if anyone has any questions about if someone is eligible, just call our member service center and we'll get you the information that you need. When you enroll in an SD Sarah sponsored plan, the premium is deducted from your monthly SD Sarah pension payment. It is a requirement that the pension benefit exceeds the amount of the premium. And so if your pension benefit isn't of a large enough amount that it's going to cover the premiums, then you wouldn't be able to enroll in an SD Sarah plan. And there's lots of options out there in the marketplace, but you've got to have a pension benefit that's going to exceed the amount of the premium. And when we look at the plans that SD Sarah sponsors, we've got two non-Medicare plans. So these are for individuals who aren't yet 65 and qualified for Medicare. And that's the HealthNet HMO and the Kaiser Permanente HMO. Those tend to be, the premiums on those are fairly high. And so again, I think that this is you always want to shop around. And I think, the SD Sarah plans are great plans out there. The plans through My Senior Health Plans are good options. So again, I think it's really important to shop around and make sure that you're getting a plan that's going to meet your medical needs and your prescription needs and coverage at the price point that works for you. For Medicare plans, we've got the HealthNet HMO, HealthNet Senior Plus, we've got the Kaiser Senior Advantage plan, and then two plans from United Healthcare. And we've got details on all of these plans outlined on our website, and then can get you any information that you may need. And I've already jumped ahead, and I'm looking at the question that just came in from Miriam. So I should probably wait till the end. So I will continue on. On our dental plans, two plans, the Cigna Dental, it's an HMO. I thought Greg did a great job providing a primer on HMO and PPO plans. It is confusing that SD Sarah offers a Cigna plan and RESDC offers a Cigna dental plan. please make sure you know what plan you're enrolling in and signing up for. And then we've got the Delta Dental PPO plan, and that it's very similar to the RESDC plan that is the Emeritus plan. And I thought Greg did a great job kind of explaining the difference between the HMO and the PPO. As we keep looking again, open enrollment information, the website to go to, you can either go to our SD-SARA website and click through to the health information, or you can go right to health.sdsara.org. And then that's the phone number that goes directly to, it's called Mercer Health and Benefits. They administer the SD-SARA sponsored plans. So when you call our SD-SARA offices, we can provide some of the information, but then we'll often transfer you directly to Mercer, who specializes in the administration of medical and dental plans. So those are the two numbers up there. And again, open enrollment starts November 1 through 19. And all the information is on our website. And I am happy to answer questions. Or actually, I think we're going to take a look here. This is on our website. This is a pamphlet that walks through all of the offerings from SD-SARA and really takes you through the eligibility, how to enroll. We have information there on the HIA allowance, and then it takes you through the details on each of these plans. So again, I would really encourage you to take a look at the website, and then if you have additional questions, just give a ring.
Thank you, Mary.
All right.
So I'm going to go. I did take the questions down. There's two. I'll go with
Okay.
the one that just came in since you saw it too. I'm still super confused about SD-SARA Medicare additional benefits. Over 65 but not retired. Way too many ads on TV.
I know there are a lot of ads on TV. Well, with the SD-SARA, with the Medicare additional benefits, I think it's really worthwhile to really, give a call. We can walk you through, and I think it's important to know, what your particular circumstances are. Again, for some people, prescription drug coverage is very, very important, and you want to make sure you've got coverage that's going to, cover the prescriptions that you're taking. And so, for your particular situation, again, I would give a call. We can provide information. I'd also reach out to. You're going to hear a presentation from My Senior Health Plans. They're a great resource as well. To make sure that you're getting the coverage that is going to meet your needs. And Mark, should I just go through these questions?
Did you see let me look at the next one here. I have it here. This is off topic, Mary, but I think you'll find it interesting. Where do we sign up to become a beta tester for the SD-SARA members portal? I don't know if you want to talk a little bit about that too, if you want. You have time.
Sure, I'm happy to talk about that. And who is asking the beta testing? That's not Sharon, is it?
No, it's Christopher.
Okay, all right. Because we are working on launching a member portal. We hope to have it up by the first of the year. We'll be doing a great deal of internal testing on that. When we do, we're going to do, kind of what I would say is a soft launch that will members then can go in and use some of the functionality. The best way to become kind of that beta tester, using it before we're really out there advertising it, is to make sure that we have your personal email on file at SD-SARA. And if you go to our website, right on the homepage, there's a spot where you can register your personal email. The people who we have those personal emails on file for will be the first person who get the link to the member portal and be able to go on there and kind of kick the tires, so to speak.
Okay, next question. We had another one come in while you were answering that one. Does COBRA ending also serve as a qualifying event with dental or even healthcare as it does with RESDC?
Yes, it does. So that's a qualifying event for SD-SARA plans as well.
Great. And then the last question I see is, I think I know the answer to this, but I'll go ahead and toss it out to you. Can I get another booklet mailed to me? I gave mine to someone. I'm trying to get to join RESDC. Awesome. Thank you for that. And I think that would just be calling your guys' member service center.
Well, in terms of the booklet, I'm not sure if they're talking about Marky. This is the confusion.
I'm sorry.
I think
this
they're
is, yeah,
talking
yeah,
about
this is the
booklet.
yeah, this is the example, right, Mary?
And so all of our information can be found on our website. If you can't access the website, we're happy to print materials out and pop them in the mail to you. For the RESDC booklet, as Greg mentioned, if you just give their office a call, they'll mail you an additional booklet.
Thank you very much. You're hired, Mary.
Oh, okay.
Okay. I think that's it. We, really appreciate the information, Mary, the continued partnership. You guys are awesome. And joining us for this, this virtual world we're living in, and really appreciate the materials you put together and the opportunity for folks to, visit the healthcare website that you guys have. It's very robust, and we look forward to, of course, working with you in the future.
Absolutely, Mark, and thanks for putting this on. I mean, I think it's a great forum for people to get educated and information on all the options that are available. And again, I would just really encourage people to, get knowledgeable, make sure you shop around. All of the plans that you'll hear from Greg and RESDC and My Senior Health Plan, it is complicated. And they're not inexpensive. So make sure that you're making the right choice for you.
Actually, Mary, another question came in while we were discussing. And the question is, if I drop Kaiser coverage, would I be eligible to rejoin them in a year or two later? I am retired.
If you drop I'm assuming the person who is sending this in, it has the Kaiser plan right now under SD-SARA. And so if they dropped the coverage through SD-SARA, they could re-enroll in that coverage at a later date. I think that's the question. So yes, they'd be eligible to re-enroll in the coverage through SD-SARA.
Great.
In the future.
Thanks again, Mary. Really appreciate it, and have a great rest of your week.
You too. Thanks, Mark.
Okay, so I'm waiting for My Senior Health Plan was going to approximately go on around 11 a.m. I'm waiting for them to arrive, so I'm going to do something else here. Hold on a second. I'm going to show you something else and highlight another great event we have coming up. Give me just a minute here. I'm going to share my screen now.
Hi, Mark. Can you hear us?
Yeah, thanks. Just give me 1 second, Pete. Appreciate it. Before I bring My Senior Health Plan on, I just want to remind folks, RESDC Virtual Holiday Fest, our second annual. Unfortunately, it's not in person. Hopefully next year, that's our goal, is coming up on Wednesday, December 8th at 11 a.m. You can find information on our webpage if you go back, RESDC homepage right here, go to RESDC events under news and events, and then you will see the RESDC virtual Holiday Fest 2021. The best part is you get to see Skip Murphy in a Santa hat. Well, maybe not. It might be me. I'm not sure. Skip and I are fighting over the Santa hat right now. But there's it's going to be a great program. We're going to have entertainment. We're going to have opportunity drawings. Must register and be present at the Zoom event to win. Our president will welcome you. I'll do a little overview of our 2021 in review, approval of the budget. So just some business things, but mostly fun. So make sure and check that out. All right. There you are, Pete.
Good morning.
Although it does say Kim Wynn. That's probably what threw me off. I kept looking for Pete or Sherry. Okay.
Good morning.
Good morning. Good morning. I'm going to just do a brief introduction, and I'm going to turn it over to you. I'm going to actually, right now, I'm going to give you co-host powers. That way you'll be able to share your screen. And before I turn it over to you, Pete, I just want to let folks know that My Senior Health Plan, we've had a long partnership with them and a very successful one for both of us. And Pete Blasi is from My Senior Health Plan. He'll be doing their presentation today. And myseniorhealthplan.com assists individuals who are turning 65 or individuals who are Medicare eligible. They provide free plan comparisons to RESDC members and help you with the enrollment process all right over the phone. And emphasis on the word free. It's a great service. It makes you more informed about some really important decisions you have to make about your healthcare insurance. So, and I do want to say, Pete, that you did get a plug from SD Sarah. They were plugging you during their presentation about the great services you provide. So I wanted to make sure that you heard that, because I know that we also have other multiple partnership opportunities available to and going forward. So without further ado, I'm going to turn off my camera. I'm going to let you share your screen. And if anything comes up that you need help with, just let me know.
Great. Thank you so much, Mark. I appreciate that. So we're here to share our screen now. There we go.
Here, we're going to do present. You go up here to present. You might have to move this far out of your way. What have I just done here to this? No? I don't know what that's.
Okay.
You have to do the start slide over here.
Give us just a moment. We're trying to share our screen now.
I see it.
Perfect. How does that look to everybody?
Good. Good.
Looks good. Looks
Great.
great.
Well, good morning, everybody. My name is Pete Blasi. I'm here with Sherry and Duke from my team.
Good morning.
I'm the CEO of My Senior Health Plan, and we've had a very successful relationship with RESDC through the years. I want to say thank you to Mary Ball. I want to say thank you to Mark Danzer as well for the wonderful introduction. We've really enjoyed working with the RESDC members through the years, and I think we're happy to say that we bring some great value to them and give them opportunity to reevaluate their health insurance and seeing what alternatives are out there for their health insurance needs. So without further ado, I'm going to run through these slides, and after I run through these slides, you're happy to ask questions, and we're happy to field those questions for you. But so My Senior Health Plan. Okay, should we maybe go to the next slide here?
6 months before you're turning 65, you're supposed to have already made a decision.
Sorting through all of this information, it can be very confusing.
So there is no one best plan for everybody because everyone has different needs. What we do here at My Senior Health Plan is we educate and help solve problems. Step one in the process is identifying what their needs are. That's a free service. There's no obligation.
And they actually helped us through the decision-making process, coming alongside of us, assessing us,
not necessarily medically, our history. We have been helping seniors find the right plan for the past 15 years nationwide to make recommendations based on your situation.
If I have any kind of an issue, I call.
I'm not a number. I am a name. We could ask for that question. Group of people. Click on Book My Appointment to speak to one of our licensed insurance professionals.
6 months before.
Well, that's a little bit about my senior health plan, but what we'll cover, you'll get to know a little bit about us, our personal approach, and our expertise. We're going to go through a bit of Medicare 101 education, talking about Medicare supplement options, Medicare Advantage options, prescription drug benefits, some additional resources you might want to take a look into, and of course, how to book your appointment. So a little bit, so who we are. We're downtown San Diego. Been here now, wow, going on 17 years. So that video's a little old now. So we are, we're nationally recognized, but and we're licensed in every state. So even if you move out of San Diego, we can still assist you. Our in-house representative provide unbiased plan comparisons. We pretty much represent all the different plans out there. We've developed a comprehensive approach that takes the Medicare beneficiary through the process of education, insurance selection, enrollment, and continuous support. So these plans change from time to time. Your needs change from time to time, but we're always here to help. So, like we talked about, we're here locally here in San Diego. We've been a proud RESDC partner for like 5+ years. We've assisted. Proud to say we've assisted a number of RESDC members through the years, and not everyone, because sometimes your current plan with the retiree plan is most appropriate. It's what's most appropriate for you. But for those that chose plans, there were significant savings for them. And I think those savings were such a savings, it could be life-changing. So our approach is a local solution with a national scope. So that's the way we kind of present ourselves. So if you're moving outside of the county, we could definitely assist. I know that sometimes there's a reimbursement. We could definitely assist with that paperwork as well. Our services are completely free of charge for resident members, of course. Our unbiased comparison, it's whatever is most appropriate for you. So especially with in your case, our representatives are familiar with the plans that are available to you, and then we do the analysis, not only the Medicare explanation, but the analysis of how individual plan would be appropriate when it comes to evaluating your group program. So they'll look at the group, not only the benefits within the group, the price that that you might have to pay through premium, and kind of compare that what's on the individual market, and see if we take it, and taking your doctor, your hospital preference, your prescription medications, price range, flexibility, all of these things into consideration when evaluating the different programs. So we conduct an annual comprehensive plan analysis that includes the different plans, and they change from time to time, especially the prescription drug programs and Medicare Advantage programs. So, and then of course, lifetime advocacy. So, it doesn't, you could call us at any point. You might receive something in the mail. Is this a bill? We'll help you sort it out. Doesn't matter if you move to Wisconsin. So we have a full staff that speaks to our clients and just helps them sort out any types of questions they might have. So we take this slide here kind of explains taking the RESDC member and kind of going through the educational process with my senior health plan. And then we go through an enrollment process. And then from that time, we service year over year. So you'll get, a welcome call, a thank you card, a special a number that you can give us a call, for any types of questions. You'll receive a monthly newsletter with healthy living and different types of updates regarding Medicare and all things Medicare. So, and all the different enrollment periods that are applicable to Medicare. So we really try to stay connected, in addition to an email and a letter explaining if you'd like to review your plan for the upcoming year, because we happen to be in the annual enrollment period. And we'll talk about that momentarily. So a little bit about our licensed representatives. They're all here in-house. They're on the payroll, so you could be rest assured all your information and everything's in a very controlled environment. Our approach is consultative. It's very educational. All of them are licensed and certified. We do have bilingual representatives in Spanish as well. So if a RESDC member feels more comfortable speaking in Spanish, or has a friend or a loved one that you think we should be speaking with in Spanish, we could definitely assist them as well. And then all the representatives and all our non-licensed representatives that are customer service, they're trained in senior sensitivity and always being friendly and courteous as well. So and we have a profile, so we try to pick up for any special requests or circumstances. We have it securely in our profile, so when they call, it's queued up, and we continue the conversation where we left off. And of course, I think it's very important. So we always speak to a live person 24/7. So most time, seniors don't like to be prompted. And so we pride ourselves, you'll always speak to a live person. If it's after hours, it goes to a live after hours intake professional, where they'll take information and then queue us up for the next day. So we don't like our clients to be prompted, and our population tends not to like that. So yeah. Some of the top carriers that are available, and there's more than these. So you'll see Aetna, United Healthcare, Alignment, Blue Cross, Blue Shield, HealthNet, Humana, Mutual, Omaha, Scan, and there's more. We just didn't have enough room. So just talking about Medicare and doing a little Medicare 101 and like what Medicare provides and how these different plans fit in. We're not going to get too deep into the Medicare 101, but I want to give you just a quick overview. I mean, just starting with the Medicare card. Oh, there we go. Just starting with the Medicare card, that has changed in the last couple of years. It used to be your Social Security plus A or B. Now they've changed it to an encrypted number that every Medicare recipient receives 3 months prior to they turn 65, or after 2 years of being disabled, and they'll receive this particular card with a encrypted number as your Medicare number. So yeah. So those who's Medicare eligible, that's always an interesting question. Like, when can I get Medicare? And sometimes that's a little bit there's a number of questions in there. So some people may be retired, but they're not actually Medicare eligible yet. So in general, it's for those that are 65 age or older, those that have been disabled for 2 years or more, and for those U.S. citizens who have been a U.S. resident for at least 5 consecutive years. So you don't have to be born here. You could, generally U.S. citizen that have been here for 5 consecutive years and worked. Those with special circumstances. So if someone comes down with ESRD or end-stage renal, or ALS, which is Lou Gehrig's disease, they're automatically eligible for Medicare following the first of the following month. They don't have to wait the 2 years. So if you're already receiving Social Security benefits, he or she would be automatically enrolled on their 65th birthday. A senior can enroll into Part B 3 months prior. So that's when you really kind of reevaluate. You take a look at those plans, and your effective date is the first of the month of the month that you were born, unless you were born on the first. It's the month prior.
Yeah. It's a little tricky.
It's a little tricky. So yeah, but we'll sort it out for you. As soon as you get that card, you give us a call. Those that have been on the, that stay after 65, that's fine as well. You might be on a group program and you're working post 65, and then you just need to contact Medicare or about a month prior to you think about leaving the group program and get the Part B turned on. But that during that month is a good time to enroll in a program, making the first of the month your effective date. But again, our reps will help you sort that out. So what is original Medicare? Parts A and Parts B, and it covers roughly 80% of your covered cost. So the exposure is the other 20%. So Part A covers hospital stays. Part B covers the outpatient services. So what does that look like? So Medicare Part A is hospital co-insurance. So the hospital co-insurance, so with that is your inpatient hospital care, inpatient mental health services, everything that's inpatient. So even blood transfusions and those pharmaceutical drugs that are administered in the hospital is all covered by Part A. Part B, what are those covered? Those are things that are outpatient services. You're going to see your physician or your specialist, your ambulance, your laboratory services, durable medical equipment. Those are outpatient services, and those have a premium for you that will be deducted generally from your Social Security. So, and it depends on how much income that you've received throughout your life is where they come up with this premium for you. So the averaging premium is of about 158 in 2022. So it's gone up significantly since I've been doing this the last 17 years.
It's only $10 from last year, though.
Yeah, okay. Yeah, I think it was under $100 when I started.
Yeah.
So it's 17 years ago. So, yep. So the next slide are the different options, the different insurance options on the individual market. So Medicare covers roughly 80%. That's A and B. So the different options there are the prescription drug program, which came out in about 2006. That's otherwise known as PDP or Part B. There's the Medicare Advantage option, which is technically called Part C, where they bundle A, B, and D to create a local plan. And these come in the forms of the individual market, like the one we represent, or on a group market as well, like the ones SD Sarah represents through Mary Ball there. And then there's the Medicare Supplement, which is generally paired with a prescription drug program. And the Medicare Supplement, there's a number of different supplements, those are a very specific type of insurance that just cover that 20% exposure, and then you grab the prescription drug program. So, and then the price ranges on that. So, but again, our reps kind of sort that out and see if that is an appropriate type of insurance to consider. So, what's a Medicare Advantage plan? It's also known as Part C. They come in different forms: HMO, PPO, special needs plans for those that are of low income or have chronic needs, chronic disorders like hypertension or diabetes and things like this. There's point of service plans, which is POS, or private fee-for-service plans. So in, like, for example, in San Diego County, we only have HMO, Medicare Advantage, and PPO, but in other states, which we also represent, they have all different types of plans under the profile of Medicare Advantage. So, which it differs by county. So they all differ by county. So these are offered through private insurance companies, and there's all types of additional benefits that Medicare generally would never cover, but they're allowed to include them within the Medicare Advantage profile, which includes things like vision, hearing care, wellness services, gym memberships, nurse phone hotline, but I mean, the list goes on. I think now they're including things like Uber Eats and Lyft and meals to your home, and acupuncture and chiropractic care, and just over-the-counter benefits like cotton balls. They give you an allowance. It's just going on, and it's become very competitive for your business. So we kind of take a look at everything and seeing what's important to you, and kind of compare those programs with the group offering. So yeah, that's definitely the new rage, and you kind of probably see a lot of commercials taking a look at all the different benefits that that are out there for you. So it's the convenience of having one plan for your Part D, for your Medicare, for your for your supplement. It's all in one plan as Medicare Advantage. These, like I said, they're limited to a service area, which is San Diego in this case. But again, wherever you go, we represent those plans, and we'll evaluate those plans and see if it's an appropriate plan to consider. They're network based, whether it be HMO or PPO is still a network, and depending on what it is, you might need a referral for your to see a specialist and things like this. But we'll explain how all that works through the representatives. So Medicare Supplement, so it covers that little piece of insurance that Medicare doesn't cover. So things like so there's a number of supplements, A through high deductible, F and Plan G. F is probably most comprehensive, but there's a lot of different supplements out there, and they're uniform throughout the companies. So an F covers the same. F is from Cigna to HealthNet to United Healthcare. But there's things like price and historical price increases and customer service still need to be considered when picking a Medicare supplement plan. The premiums, vary by from carrier to carrier. So they cover anywhere in the United States. Outside of the United States is generally up to $50,000. And again, going back to the Medicare Advantage plans, those are covered worldwide, and there are some nuances to that the insurance representative will show you, and something to read on through the summary of benefits as well if you're plan on living overseas. So the prescription drug program, also known as Part B, offered through private insurance companies. Prescription drug, there's a standard prescription drug format for Medicare, but these plans could enhance that to attract membership, and that's what they try to do from year to year. Each plan has a formulary of drugs that are covered. These drugs are listed in different types of tiers. You may be aware of different types of tiers, or even on your group program. So, and these tiers come with different types of cost or co-payment, or co-insurance generally could be for different types of brand name drugs. And for those that say, well, I don't take any drugs, I don't want the prescription drug program. If you do not pick them up when you're first eligible, there could be a penalty if you pick up a prescription drug program later on. So later on, if someone enrolls into a drug program, 5, 10 years later. So again, that's something that the representatives will go through with you. So Medicare and COVID-19. Sherry, you want to talk to us a little bit about this slide?
Sure, of course. Hello, everyone. We know that obviously COVID has been, top of mind for the last, 2 years now. So Medicare has come out with some new things that obviously previously weren't there. So many people with Medicare are at higher risk, obviously. We've learned that through the news, seniors and things like that. So it's important to take the necessary steps to keep yourselves and others safe. Medicare has now decided to cover several items and services related to COVID-19. But obviously you'll want to talk to your doctor or healthcare provider to see which ones are right for you. First and foremost is vaccines. Obviously, some people are getting them and some people aren't. And the FDA authorized vaccines to help reduce the risk of COVID-19. And through Medicare, you pay nothing for the vaccine. Be sure to bring your red, white, and blue card with you when you're going to get the vaccine, so that they know that obviously you're on Medicare and they don't charge you anything. As far as diagnostic tests, the FDA authorized tests to check if you have COVID-19. So those are covered at, you pay nothing for this test during the pandemic. They also have antibody tests, which is very interesting. Not everyone offers this, but Medicare has decided to cover this for free. So you pay nothing to test during the COVID-19 public health emergency to see if you have the antibody. And then also the monoclonal antibody treatments. The FDA has authorized treatments that can help fight the disease and keep you out of the hospital if you've tested positive. You also pay nothing for this treatment during the public health emergency, which is obviously still going on. But for more information, more detailed information, obviously our representatives will help you with that piece. But I did list here the site that you can go to get really detailed information on everything covered as far as COVID-19 by Medicare. All right.
So, enrollment eligibility. So this is something like if you're just turning 65 and for someone who's eligible to enroll into Medicare or prescription drug program, like we talked about earlier, generally 3 months prior to they turn 65, and the month of their birthday, it would be the first of that month. So for someone can enroll, but coming from your group program, I think it's really important that if you're on your group program and you're like, I want to evaluate, I've been 65 for a long time. Well, you could give us a call at any time, because technically that's a special election. So generally the annual enrollment period, which is we're in the middle of right now, is between October 15th through December 7th. At this time, someone can change, reevaluate their plan for the prescription drug program or their Medicare Advantage program. So then there's also another enrollment period if you want to make one more switch from your Medicare Advantage program. That's from January 1st through March 31st. So I think it's really important to know that if you've been on a group retiree program, you're Medicare eligible for many years and you're 70, 75 and you want to look into this, you definitely can. And you can make the change anytime, anytime, all year long, because, and you're not subject to that Medicare enrollment program because you're technically on a group program. So you could give us a call and have us reevaluate the program. And if you do decide to make a change, you can definitely make a change, and then the first of the following month would be your effective date on a new program. So I think that's really important for RESDC members to know. And how we bring value to RESDC members is a number of different ways. So evaluating their county retiree group program to the individual Medicare program nationwide. So there's a lot of things to consider. And like I said, sometimes staying on the group program could be most appropriate, but we take everything into consideration, like how much premiums you're paying, how much co-payments you're paying, are you paying too much for prescription drugs? You know, is your plan meeting your overall needs? So it's all about you. So we have this concierge approach. And then, like I said, sometimes it's best to stay on your program, and sometimes it's good to evaluate the program and make a switch. So everybody's different, and all plans are different. Everybody's needs are different. So we always say whatever's best for your neighbor could be disastrous for you. So it's you know, everybody has different needs. So we pride ourselves on high standards of service. So after enrollment into the plan, like we talked about, you know, thank you cards with the magnet, people still love magnets, birthday cards saying that we're here for you and happy birthday. The monthly newsletter, you know, we do, it's not just a newsletter to us, we really try to provide great content, something that you'd be, you know, engaged with, and you'd bring you back. So we do it printed, we do it on the digitally. So post enrollment support for many years, and just, you know, advocacy, claims, billing, or any of these companies give you the runaround. So we're here for you. So and of course our services are always free. You know, we get compensated from these different insurance carriers. So and we're fine with that. And so so we love that we can provide our services free of charge. So this is a little bit of how to engage with us. You can call this number. Also, these are some additional information. There's Medicare.gov out there, and also to schedule your appointment with, you know, with this link here. So I think on the wrap up, Mark has an email he'll be sent regarding how to get in touch with us if you want to schedule an appointment. There's a unique link just for to schedule an appointment when a time is best for you. So you could go on there and take a look at the different times and pick a time yourself, and then one of our representatives will reach out. At this time, I'm myself.
Hey, Pete, looks like you're freezing up a bit. I'm not sure if it's you or me, but what I want to say is, yeah, can you hear me?
Yep.
Okay, there you are. I love the way how you and Sherry would come in and out of the blur. That's kind of cool effect there. But first of all, thank you both very much, Pete and Sherry. Very comprehensive presentation. And Pete, I know you and I have talked about this, but I want to make sure everybody in attendance knows that I've talked to various members who've taken advantage of your services and have been very pleased with the work that you guys do, the support you provide. So I just want to make sure and reiterate that. And the good news for our attendees today is that this PowerPoint and other information, we can send an email out to you where you can click on the link and get right into the My Senior Health Plan calendar. All you have to do, Pete, if you don't mind stopping your share for just a second. Because I'm going to give you a way that you as attendees can just send us an email at resdec@resdec.net, but I'm going to bring it up on the screen so that we can make sure it's there while we go through the questions. I have a couple questions, Pete. Let's see here, give me a second and I will share this. So simple as that, just shoot us an email, or you can even call us at 619-688-9229 and ask for a copy of both the PowerPoint that Pete just presented, which also has clickable links in them, in the PowerPoint. It's a PDF version of the PowerPoint, but you can click on the where there are links, and it will shoot you out to the various websites that and the calendar that will give you an opportunity to schedule an appointment, a personalized appointment with My Senior Health Plan, resdec@resdec.net, and we'd be happy to get that to you quickly as well. So Pete, I got a few questions. Couple. You actually answered one of them. It was how is My Senior Health Plan compensated for their services, and you talked about it that with the in particular the companies, the insurance companies. And did Medicare change from Social Security number identifier to encrypted number because of confidentiality and security reasons?
Yes.
That was an easy answer. We like those easy answers. And then you threw a curveball. I mean, I was expecting a long diatribe, but thank you. There's a couple more. Let's see. I think the rest of them are more questions for RESDC, which we can respond to. And it was one, and I want to remind folks too, as well, that if you receive information from RESDC and materials, just to remind you, anyone participating in RESDC plans, if you don't want to make changes, there's nothing to do. And if you have SD-SARA Dental and you want Pacific Group dental plans, you will need to disenroll from the SD-SARA dental plan and enroll in the PGA Dental as a RESDC member. So that's just a question that came through RESDC that we wanted to make sure and get in front of everybody. And once again, resdec@resdec.net, and we'd be happy to forward you the information that Pete went through today. That way you have it at your disposal. You can read it. The other thing is, once again, to remind everybody, just give me a second here. I got to switch some screens. And I'm going to show you one more time the RESDC YouTube page, because this presentation is going to be loaded up there in probably a couple days. And you'll be able to see that presentation. If you weren't be able to make it live, you can refer friends, neighbors, family members to the RESDC website to be able to access the YouTube page. Here it is right here. It'll be posted up here. It'll probably be the first one. And that's going to give us a couple days on that. We'll get that out to you. And that's another way to see the presentation and learn all the great information that was shared today. Let's see, did I have anything else? I'm going over my notes here. Quick questions. It looks like we have everything that we went through. I've answered Pete and Mary and Greg answered all your questions. Don't ever hesitate to reach out to us though, at RESDC, at My Senior Health Plan, at Pacific Group Agencies, and I'm going to bring that up too. Once again, here's the contact information for all three. And I'd be happy to email that to you as well if you want to reach out to us at resdec@resdec.net so that you can contact these folks. We know how difficult it is sometimes keeping up with the array of numbers and email addresses, but don't hesitate. We're here for you. We can help you through that and get you the information you need to be more informed about all these important decisions. Pete, thank you again very much. And we really appreciate your time and Sherry's time. Thank you, Sherry. It was great working with you.
Great working with you as well.
Oh, thank you. Thank you very much. And we'll be in touch. And thanks everybody once again. RESDC Holiday Fest, Wednesday, December 8th at 11 a.m. You're going to see more information in our newsletter, The Network. You can also find it on our events page at www.resdec.net, and we hope to see you all there. I hope everybody has a great day. And once again, thank you all for participating. And of course, we really appreciate your membership. It means so much to us that you have chosen to join RESDC. Take care, everybody. Bye-bye.
Bye-bye.